A cyber attack on one hospital is bad enough. Computers offline, vital patient information inaccessible, stressed doctors and nurses plunged into chaos. But what happens when 100 hospitals are targeted at the same time? This is the story of that scenario playing out for real, and how, against all the odds, Romania showed the world how to cope with an ever-increasing problem: our healthcare under attack by hackers.
Hospitals at the moment are in the top three industries that are targeted by ransomware operators.
The hackers struck at the weekend. They infiltrated computer systems of a Romanian company that makes a hugely popular medical software.
The Hippocrates information system handles everything from patient admissions to payroll, pharmacy logistics, and everything in between. So it's a very important software that's used by the medical system in Romania.
Staff at the Pitești Children's Hospital were the first to see errors on their computer screens and wonder what was happening. But by now the hackers were silently and methodically spreading out to other hospitals that use the same medical software. Early on Monday morning, alarm bells started ringing around the country. It wasn't just one hospital. The Hippocrates system was offline for others too. In its place, a message from the criminals. Attention, your network has been hacked and files are encrypted. The criminals had used ransomware, a victim's worst cyber nightmare. Every file stored on the Hippocrates system was scrambled to make it unreadable. The name of the ransomware and the group that did it was plain to see, as every single file was now called Back My Data.
Ransomware operations are run like a modern-day business. You have the developers of the malware, you have their affiliates who usually carry out these attacks, you have PR, you have marketing services, and even customer care for victims.
By 7 a.m. on that third day, experts at Romania's Cybersecurity Centre realised they were dealing with a serious situation at many hospitals.
Actually, I was in this very place, and somewhere on my left you may notice three phones. These are very important phones, direct line, encrypted lines, and if any of them is ringing, that's usually bad news. It's a very complicated day. And that day, two of them were ringing because of the incident. We got the news that one after other Romanian hospitals, half of them being emergency hospitals, were impacted by ransomware attack.
At Buzău Hospital, Dr. Oana Goidescu was on shift when her colleagues started complaining about computer problems. The critical software was out of action as patients began filling the waiting rooms.
A fost o experiență destul de neplăcută pentru că o evidență informatică înseamnă nu doar o evidență a numelor pacienților care se găsesc în spital. Pentru fiecare pacient noi facem niște cereri către laborator, către la radiologie, către farmacie pentru eliberare de medicamente, scădem materiale sanitare, ținem evidența tuturor manevrelor și a procedurilor pe care le facem pe pacient.
At another hospital, more confusion.
We tried to access the data of the patients in the computer to see some biological results, and we found out that the system didn't work. So we tried to figure out what is happening. We tried it on several computers, and we found out that in all the computers the system didn't work.
The call went out from the cyber centre. Disconnect from the internet now. 100 hospitals went offline. No access to Hippocrates, but also no emails, internet-connected instruments and equipment, even web browsers.
So I was at work and we got the news about the ransomware attack. As a citizen, it was pretty scary because it became very real. Just thinking about how it could impact a family member or a loved one. Any ransomware attack that targets healthcare facilities is very, very serious.
By late afternoon, it was confirmed that 21 hospitals had been infected with the ransomware.
Bună seara și bun găsit la știri, un atac cibernetic.
Oana and her colleagues say the stress was building and some patients took it out on staff.
De cele mai multe ori ne trezim cu interogări de genul vi se pare normal că, sau dacă ați fi în locul meu, sau dacă ar fi mama dumneavoastră. E adevărat, au dreptate, numai că nu noi suntem vinovați.
Meanwhile, hospital IT staff like Bogdan were tasked with trying to get the system safely back online. Luckily, he and his team had done a recent backup, so they worked fast to get things back to normal.
That was the biggest problem from all the attack, trying to cope with the rest of the medical staff. They were a bit panicked because they couldn't ask for medicine. Everything is on the server and it's on the computers, and everything was locked down, and they had to resource at paper and pen.
Cyber experts at the DNSC worked through the night with the Hippocrate maker to contain the breach and kick the hackers out of the central system. It worked. The next morning, once they'd been checked for infection, dozens of hospitals were able to start coming back online. But investigators also discovered more hospitals had been infected. A new count put the total at 26, the DNSC told the public, and implored the hospitals not to negotiate with the hackers, who were demanding 3.5 bitcoins, roughly 160,000 euros, in exchange for the decryption key to reverse the damage.
Paying ransom does not guarantee that cybercriminals will provide you with a decryption key. And even if they do, that doesn't mean that your data will not be exfiltrated and will not be sold on the dark web or reused.
If they had exfiltrated the data of tens of thousands, hundreds of thousands of patients, maybe millions, would that have changed your mind on paying the ransom?
Would not. That's our line, and we truly believe this is the right thing to do. It's very, very important not to finance the phenomenon.
Remarkably, most of the hospitals that got hit had fairly up-to-date backup databases, so work began to rebuild the Hippocrate system with previously saved data. In the meantime, doctors worked hard to manage and created workarounds. Their actions no doubt kept people safe, and there were no deaths or serious harm to patients recorded because of the hack.
We developed an offline method on the computers, so we could register every patient that comes in the hospital. We talked to the laboratory to give us the results on paper and also on email. We used also Excel and all programs available offline, so the medical care wouldn't be affected by this situation.
By Wednesday, day 4 of the attack, most hospitals were already back online. Things were returning to normal, but there was still a great deal of cost and harm, as some hospitals' backups were less up to date than others.
It was data loss, that's not a secret. We know that some of them rebuilt the data from paper records or from other type of records. They accumulated backlogs and of course took them weeks to absorb completely all that backlog.
Authorities won't say how much the cyber attack cost the health service. They say investigations are still ongoing. But last year, the website of a ransomware gang with strong links to back my data was taken down in an international police operation. 4 Russians were also arrested outside of Russia, which does not cooperate with Western law enforcement requests. Romanian police were involved in the arrests, but would not say if it was related to the historic hospital's hack. Of course, this isn't the first time that hospitals have been hacked. There have been lots of cases in the past of cyber attacks that have hit either individual hospitals or groups of hospitals. For example, in 2017, NHS hospitals in the UK were caught up in an enormous global hack called WannaCry. No number was given, but at least 40 hospitals were affected, with 7,000 appointments cancelled. In 2021, hackers caused chaos at 31 different hospitals in Ireland. But neither of these cases were deliberate. The first was an uncontrollable computer virus that affected thousands of other organisations as well. And in Ireland, when the hackers realised that they'd hacked hospitals by mistake, they gave away the decryptor key for free. There used to be rules and morals in cybercrime. Not anymore. In the last few years, hospitals and healthcare providers have been deliberately and increasingly targeted by hackers. In 2024, just months after hackers struck Romania, hospitals in London were also plunged into chaos as a blood testing company called Synovis was hacked with ransomware. Last year, a review of the incident concluded that the attack directly contributed to the death of 1 patient. In Romania, things could have been far worse.
No one died, to the best of our info, because of the cyber incident, but the risk is there nevertheless. It happened, can happen to any country. The more advanced, the more technology you have, the more digitized you are, the risk is there. Resilience is key to be built. Exercises are key in order to prepare the teams, to prepare everyone at national or organization level for such scenario. I was myself also proud about the level of solidarity shown.
The cybersecurity world has praised Romania for the way it handled the hack. The country may well have set a blueprint for how others can cope with the increasing risk of our healthcare under attack.